And this is my preparation for the presentation for Orchard Place Integrated Health Home Health Systems. My name is Ricky Williams, and this was my capstone project for the spring of 2015. Background on the project. It's originally an orphanage named the Des Moines Children's Home. It's been operating since 1886. It includes inpatient and outpatient community programs and serves nearly 10,000 children from birth to age 22 annually. More background, there are 4 branches of Orchard Place. First, there's a PMIC unit, which is a live-in mental health facility for youth. Next, there's a child guidance therapist office for outpatient therapy. There's the PACE Juvenile Center and the IHH Integrated Home Health System. The purpose of the project is to ensure that documentation is done properly per HIPAA and JCO standards, and also to ensure that the entire family issues are being taken into consideration when treating the children. There were documentation issues that we addressed, which is placing family-oriented information into individuals' medical records and finding a way to make the client's information easier for employees to access when cross-referencing, and also to find solutions so information is legally documented. My analysis and findings were that HIPAA officer stated the information could be included in the children's record so long as it was directly related to the child that the file concerned. Also, the Joint Commission officer stated that as long as the family information was charted about how it affects the children, it can be included in the same record. The problems that we identified when we were doing the research was first and foremost, how to properly document in an individual's records that involve other family members, and also to be sure to identify privacy laws and HIPAA or HIPAA issues. The research method and procedures. There were management reviews. Also, we interviewed peer support specialists, made contact with the Joint Commission officer, and also interviewed with the HIPAA officer as well. The analysis and findings. First, the Vice President of Division felt that the suggested changes need to be reviewed by the proper people, which were the Joint Commission officer and the HIPAA officer, to make sure that all the information was covered and that each issue was addressed by the proper regulating agency. The Joint Commission officer recommended that information can be included if properly documented, and the HIPAA officer agreed with the Joint Commission officer that information can be included so long as it's properly documented. The recommendation and action plan to document family issues as they affect the client, so to provide family peer support training on documenting family issues and how they relate to the client. In conclusion, the Joint Commission and the HIPAA officer will train family peer support specialists on how to make sure the wording is correctly and the information to keep it legal on the client's records that are already established. And also the entire company will get memos about the changes, the client's medical records, and that will now include family notes.